Hi everyone, I'm Allie Williams, and today I want to discuss depression in the primary care setting. I'm going to talk about how to use a screening tool for primary care providers on their patients when they come in for routine screening to assess for depression. Depression is one of the most common illnesses faced by primary care providers in the United States. While current guidelines call for routine screening and follow-up care, many patients with depression often go undiagnosed and undertreated. Depression is highly prevalent in the United States, accounting for 18.8 million adults, or 9.5% of the United States population greater than 18 years of age. Primary care is now the most common healthcare setting where people with depression go for initial consultation, treatment, and follow-up care. Therefore, primary care providers must be highly educated and able to diagnose and effectively treat depression. Studies show that primary care physicians who provide usual care fail to recognize depressive symptoms in approximately 30 to 50% of patients with depression. Routine screening of depression in primary care settings is the most important step towards identifying those affected with depression. Many instruments have been developed for depression screening use in the primary care setting. The most widely used and best validated tool is the Patient Health Questionnaire 9. This screening tool addresses 9 questions and is 81% sensitive and 92% specific for major depressive disorder in the primary care setting. This tool also measures severity and can be used at follow-up visits to evaluate the effectiveness of treatment. It is based on the diagnostic criteria for major depressive disorder in the Diagnostic and Statistical Manual, 4th edition. Patients can fill out the PHQ-9 by themselves while waiting for their primary care practitioner. It takes less than 3 minutes for them to fill it out and for the practitioner to score it. The questions are ranked from a score of 0, not at all, 1, several days, 2, more than half the days, or 3, nearly every day. The PHQ-9 is based on the last 2 weeks, and the questions are, in the last 2 weeks, how often have you been affected by the following problems? Number 1, little interest or pleasure in doing things. Number 2, feeling down, depressed, or hopeless. Number 3, trouble falling asleep, staying asleep, or sleeping too much. Number 4, feeling tired or having little energy. Number 5, poor appetite or overeating. Number 6, feeling bad about yourself or that you've been a failure or have let your family down. Number 7, trouble concentrating on things such as reading the newspaper or watching television. Number 8, moving or speaking slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual. And number 9, thoughts that you would be better off dead or hurting yourself in some way. Then the last question, number 10, asks if you checked off any of these problems, how difficult have those problems made it for you to do your work, taking care of things at home, or get along with other people? This tool is scored by the practitioner, and scores are categorized as minimal depression, 1 to 4, mild depression, 5 to 9, moderate depression, 10 to 14, moderately severe depression, 15 to 19, and severe depression, 20 to 27. The PHQ-9 can be administered multiple times as an indicator of improvement or worsening of depression in response to treatment. A depression diagnosis that warrants treatment or needs treatment change needs at least one of the first 2 questions endorsed as positive, so more than half the days or nearly every day in the past 2 weeks. And also the last question about difficulty at work or at home or getting along with others should also be answered at least somewhat difficult. This tool then provides education on how to go about treatment depending on which category the patient is in. This tool is a freely downloadable tool that you can get off of the internet and has been proven effective in many primary care settings. So we need to be educating our primary care practitioners to use this on patients that come in for routine screenings, because we could be missing depression and could be masked by other somatic symptoms. So we definitely need to be using this tool and assessing our patients for safety. Thank you.